And just thank you so much for taking the time to join us. We are excited to be presenting and discussing the PathWays PA's report, Overlooked and Undercounted. My name is Michelle Legaspi-Sanchez. I'm the Exec Director of the Chester County Fund for Women and Girls. And though this is one of our first virtual events, the Chester County Fund for Women and Girls is not new to bringing together our community to learn about the needs of women and girls and inspiring action to meet those needs. Our organization has been around for over 20 years, utilizing advocacy and philanthropy to ensure that women and girls have the resources and opportunities to thrive. We fund local organizations that are addressing inequities and mobilizing to advance community-based solutions. Since our inception, we have granted out over $3.8 million to about 80 organizations serving women and girls. And we raise up the next generation of leaders to lead now and in the future through our award-winning programs, our Girls Advisory Board and the Girl Gov Chester County program. We also amplified the voices of all women and other disenfranchised groups through education and advocacy, particularly through our Blueprint report. And so for those of you new to our Blueprint, it is a comprehensive study that we released with Westchester University, which looks at how women and girls are faring at the county, state, and national levels. And we are just getting started on our 4th edition. So like us with our Blueprint, our friends at PathWays PA have a long history of bringing data and information to the forefront through their Overlooked and Undercounted report. Since 1997, PathWays has worked with the University of Washington to calculate the Self-Sufficiency Standard of PA, which looks at the number of households living above and below self-sufficiency. The standard has documented the continuing increase in the real cost of living, illuminating the economic crunch experienced by so many families today. I have loved and used this report ever since I began working in nonprofits in Chester County. As you'll see, it shines a light on the real cost of getting by in our community. And that's a cost that's higher than our neighboring counties and a cost many women and their families, particularly women of color, struggle to reach. And not for lack of effort and ability, but because the systems we have in place make it an uphill climb. I'm confident that you too will find the program we have in store for you revealing and hopefully challenging. We have over 150 people registered for this virtual event with diverse representation from nonprofits, foundations, county employees, corporate, the faith community, and other individuals who have connected with this topic for one reason or another. We are all coming at what it looks like to be self-sufficient from different angles, and wrapping our brains around self-sufficient amidst a pandemic certainly adds a new layer that we are all feeling our way through. In particular, I wanted to recognize the 14 elected officials who took a step to join this conversation. County Commissioners Marianne Moskowitz and Josh Maxwell, State Representative Christine Howard, State Senator Tim Kearney, Westchester Mayor Diane Herron, County Controller Margaret Reif, Clerk of Courts Yolanda Vanderkroll, as well as staff from the offices of Senators Casey and Toomey, Representative Chrissy Houlihan, State Representative Judy Schwenk, Dan Williams, Melissa Schusterman, and Carolyn Committa. Your voices and participation are absolutely critical in order to build lasting systemic change to help those who are overlooked here in Chester County and beyond. So thank you so much for being here. A few housekeeping notes. All attendees are muted until the breakout sessions. Questions and comments can be entered into the chat. And also when you list your name and your little square there, feel free to include the name of the organization, company, or group that you are representing. This, of course, is a suggestion just to encourage ways to connect, not a requirement at all. Also, please feel free to share what you are learning and hearing via social media platforms, Twitter, Facebook, LinkedIn. Tag the Chester County Fund for Women and Girls and PathWays PA so we can be sure to amplify your thoughts to a larger audience. So now we will move forward with our lineup of speakers, and then we'll move to breakout sessions at 9:45. We will then come back to reconvene as a large group after, and the session will end at 10:30 a.m. And the last note is just to let you know that the presentation is being recorded and will be available after. I'd now like to turn it over to Erin Langan of PathWays PA and Marianne Bellassarti, currently of Family Values at Work, and formerly of PathWays PA. Erin serves as case manager for PathWays Project Peace program, where she uses the report or the standard as a tool to help her clients. And prior to Marianne's current role as National Implementation Director at Family Values at Work, she was at PathWays as a driving force and an encyclopedia behind the standard. We are so grateful that they've joined us today, and more information about all our speakers can be found in today's handout. And Maeve, my colleague, will be placing the links to the handout as well as some other documents that will come into play in the chat box. So please pay attention to that. Questions will be taken after the presentation. And again, you can use the chat box to add your questions during the presentation and after. And I'll be reading the questions aloud to Erin and Marianne after their presentation. So Erin and Marianne, you want to go ahead?
Thank you, Michelle. Good morning and welcome, everyone. I'd like to thank you for joining us today. As Michelle said, my name is Erin Langan, and I am the case manager for PathWays PA Project Peace. PathWays was founded in 1978 to serve women and children. Our mission is to help women, teens, children, and families achieve economic independence and family well-being. As the case manager for the Project Peace program, I provide parenting education and case management services to pregnant and parenting moms ages 13 to 24 in Delaware County. At PathWays, we also have the Center for Families. This is a shelter for homeless women and their children that promotes education, teaches parenting and life skills, fosters self-esteem, and move women toward attainment of their life goals, family well-being, and self-sufficiency. To start, I'd like to give you some background information about the Self-Sufficiency Standard. It was created in the 1990s by Dr. Diana Pierce, a professor of social work at the University of Washington. PathWays has worked with Dr. Pierce since 1997 to calculate the standard in PA. This report would not be possible without the generous financial support from the Gender Justice Fund and the Women and Girls Foundation. So how does the standard stack up with other poverty measures? The federal poverty level was developed in the 1960s. We do have some slides to put up. It was based on the cost of food, which at that time was calculated as 1/3 of a household's income plus inflation. There was no difference for the level geographically. In 2020, it is now outdated. However, it is still used to determine eligibility for some government assistance programs, such as SNAP benefits. Another poverty measure comes from the United Way, named ALICE. This acronym stands for Asset Limited, Income Constrained, Employed. It is based on 6 family types and is something you can use with the standard as another way to look at costs. To learn more about ALICE, please visit the United Way's website for more information. PathWays has relied on the Self-Sufficiency Standard since the late 1990s. It includes 700 plus family types. It is based on all major budget items faced by working adults, not just food. These basic needs include housing, childcare, food, healthcare, transportation, taxes, and miscellaneous costs. This standard is one of the first reports to calculate basic needs using local and regional costs, assuming all adults work. In contrast, the federal poverty level assumes a 2-parent household with a stay-at-home parent or a single parent relying on welfare. Therefore, work-related expenses are not considered. Next slide, please. So what does the standard look like in Chester County for 1 adult, 1 infant, and 1 school-age child? The data used to answer this question was collected or calculated using standardized or equivalent methodology nationwide, obtained from credible sources such as the U.S. Census Bureau. It is set at the level that meets a given need at a minimally adequate level, usually by or for a government aid agency. It's updated regularly, usually annually or biannually, and geographically and or age specific as appropriate. So let's take a look at housing costs. You will notice that costs increased by almost $60 from $1,284 in 2012 to $1,346 a month in 2018. So moving on to childcare, you can see a dramatic increase here. In 2012, this family was paying $1,476 a month, and in 2018 was paying $2,228 a month, an increase of almost $800. With an infant and before and after school care, this is a big portion of this family's monthly budget. So moving on to healthcare, in this instance, we assume that this is employer-based insurance. With that in mind, healthcare costs have increased significantly from $354 in 2012 to $554 a month in 2018. So looking at this family's food budget, that has actually decreased from $680 in 2012 to $675 in 2018. But keep in mind, this doesn't account for any dining out. So no special birthday dinner at Mackenzie's or no quick trip to McDonald's for a Happy Meal. Moving on to transportation, you can see that decreased as well from $290 a month in 2012 to $265 a month in 2018. Also note, this number only accounts for transportation to and from work and daycare, and then one weekly shopping trip for groceries and other errands. So let's take a look at the miscellaneous items. So these items would include diapers, cleaning and paper products, hygiene products, over-the-counter medications, and telephone services. This number is calculated by taking 10% of all other costs, but this doesn't account for, say, a night out at the movies or any extracurricular activities for kids like gymnastics or soccer. So you can see there was an increase of almost $100 a month for miscellaneous items. So let's take a look at taxes and tax credits. As you can see, for this household, there was a significant increase of over $400 between 2012 and 2018. However, the tax credit increase was only a little bit over $150. So moving on to the total salaries. So for this family to be self-sufficient in 2012, they needed $63,000 a year. In 2018, they saw an increase of almost $20,000 a year to be self-sufficient, and they would need to earn $79,518 a year, or almost $38 a month. Next slide, please. So let's see, did the wages keep up with costs? So what this graph is showing is many people are not earning what they need to be self-sufficient, even though they are cutting costs where they need to and using credit cards to pay their bills. Work does not always guarantee income. As you can see, the PA Self-Sufficiency Standard increased 31% on average, but the wages only increased by 17%. So clearly, wages are not keeping up with costs. We can't keep telling people they need to work more hours to solve the problem. To solve the problem, they need to be paid higher wages. Next slide, please. So how have things changed over time for this family? The benefits of doing the standard for so long is that we can look back at changes over time. We can go back to over 20 years to see the cost of living in PA in every county. In 1999, families in our area needed about $35,000 a year to be self-sufficient. Now, looking at the graph, you can see that they need twice that much. In 1999, the minimum wage was $5.15 an hour and was increased to $7.25 an hour in 2009, and that's where it has remained for the last 11 years. The federal poverty level never met the standard, but 20 years ago, it was much closer to it than it is now. And now I'd like to introduce Marianne, who will be completing the second half of our presentation.
Thank you so much, Erin. I want to just say briefly a little bit more about who I am. My name is Marianne Bellassarti. I am currently the National Implementation Director at Family Values at Work, which is an organization that works to help all families have access to paid sick days, paid family leave, and other programs, especially through working with our coalitions currently in 27 different states. But before that, I was at PathWays PA for almost 14 years. I have worked with the standard in some way or another for about 20 years, and I'm so thrilled to be able to come back and continue sharing information about it. Could we see the next slide, please? So we wanted to talk just for a minute about what the key findings are in the self-sufficiency standard. And you're going to get a chance in your breakout rooms to go even more in depth and learn a lot more about the standard. But here's what we've learned from this most recent version. 79% of Pennsylvania households living below the standard have at least one worker. So we're not talking about households where people are not working. The work effort is there, and it is, it's happening in most of the households below the standard. 48% have at least some college education. 70% have a high housing cost burden. 53% of these households have at least one child, which I think is also an interesting factor. That means about half of the households below the standard have at least one child and half do not. And again, you all will get a chance to look at this further. From my perspective, I think the cost of childcare plays a pretty big role in families living below the standard, but obviously that will only count for those who also have children. Only 31% of Pennsylvania households below the standard receive food assistance. This is something that, we talked about a lot at PathWays PA when this came out. And the fact is that the other almost 70% probably don't qualify for SNAP and have to rely on food pantries or other ways to get food. Finally, about a quarter of Pennsylvania households below the standard are married couples with children. And in a minute, we'll get a little bit more into some of the other breakdowns within the standard. Next slide, please. So how many households in Pennsylvania lack adequate income? This is a question that we get asked probably most often. And so we felt like this map was really important to show that families are living below the standard across the state. You'll see that the highest percentage are in Philadelphia. But beyond Philadelphia, the group with the next highest percentage of families below the standard are scattered statewide. So you see Armstrong County, Indiana County, Center County, and Lehigh County all have between 31 and 34% of households living below the standard. The band of counties right around Philadelphia, not including Delaware, are all in the lowest percentage. But even here, we see that at least 16% of households are living below the self-sufficiency standard, and it goes as high as 21% of households. So it's really important whenever you're talking about the self-sufficiency standard or a family's needs in general to point out that this is not a problem of the city or really of the more rural areas of our state. This is a statewide issue. Next slide, please. So this chart shows a little bit more about the families who are below the self-sufficiency standard. And again, this is only talking about the 848,000 households living below the standard. This is not representative of the entire state, but just that group. You can see, first of all, the first column looks at the age of the householder, and just about all ages are represented below the standard. The self-sufficiency standard only looks at households between the ages of 18 and 64. When it was designed to look only at households that were expected to have a worker in them. So it did not look at households over age 65. It did not look at households led by people who were disabled and not expected to be in the workforce. That is the way the standard has been for quite some time. Certainly a consideration when you're looking at these numbers, but it's something that is important for you all to know right now. The group most heavily beneath the standard are those between 25 and 34 and 35 and 44. And again, I think that's where you can see the role of childcare probably coming into play. You'll see that at 31% of families have food assistance, but the rest do not. Educational attainment is very important to look at. There is certainly a high percentage of families below the standard with a high school diploma or even less than a high school diploma. But you can also see that many have some college experience, and almost 20% have at least a BA. So while educational attainment is key to people being able to move above the self-sufficiency standard, again, it doesn't play the only role. Family type is another place that I think is really important to look at. You can see that about half the families below the standard have no children. The other half have children and are split fairly evenly between being married with children and being a single mother. A single father also plays a role in this breakdown. I'm fairly certain the last time that we did the self-sufficiency standard, the single father line was much smaller. So I think it's really interesting that you're seeing more of a comparison between different family types. And certainly it's important to know that being married does not automatically bring you above the self-sufficiency standard. If there's one thing that you can tell by all of these numbers, there is no one thing that people can be doing in order to become above the standard. And it's just, I think, so important to take a look at these different family types and make sure that people are confronting what they think a family below the standard would look like. Just a little bit more here. As we said before, many of the households below the standard include workers. About 30% have 2 or more workers in the household. And finally, when you look at race and ethnicity, again, since this is just a snapshot of the households living below the self-sufficiency standard, you'll see that white families are a big part of this group below the standard, but that Black and Latinx families are disproportionately represented compared to the percentage of those households in our state. And this gets back to racial inequities that have been in place for quite some time. I think some of you in the breakout sessions will be looking a little bit more closely at unequal pay among Black and Latinx families, for instance. I think there's a lot more to be learned here. Next slide, please. I want to talk just quickly also about kind of the elephant in the room, which is COVID. This report was released on February 12th in a big room in Philadelphia where none of us were all that concerned about wearing masks, certainly, or being close to one another. And now we're presenting it in a world that is much different. It's going to take a long time to know exactly the effect that COVID will have on the self-sufficiency standard. But what we can say is that, it will come through eventually. I did have a talk with some of the researchers just to get a better sense of what we might see. They don't expect the cost of food to change because of COVID, but I will say that for those families who were able to get free meals at school, for instance, certainly having to pay for that out of pocket will make a big difference. We're not seeing a change in housing costs yet, but again, that's something that over time, especially as eviction moratoriums may expire, we may see some changes. No change in the cost of health care yet. Health care, as Erin mentioned, comes through the employer when we're calculating the standard. And we'll probably start seeing changes if we're going to see them, I would think, around the end of this year. The cost of childcare is definitely something to consider. Many families are keeping their children at home right now, often out of necessity. Some of them, though, are still paying childcare costs just to keep that slot available for the childcare provider so that their kids can go back there at some point. Other families with very young children are going to have to figure out what to do during the school year, especially for those whose kids are going to be at home working online but still need some kind of supervision. That could certainly change childcare costs depending on what might be available. And we know that in general during this pandemic, childcare is facing a huge sea change, and we will just need to see what happens and hopefully be able to work with childcare providers and the federal government and others to make sure that things work out well and that the workforce does have good childcare to go back to. With transportation, we know that gas costs a little bit less right now. People aren't making as many trips, certainly, as they used to. But since the standard covers very limited transportation to begin with, we don't expect there to be a huge change there. Next slide, please. So I'm sure that after hearing all this, you all probably have some questions. Erin and I would love to answer them. But we also want you to know that all of this material is available on the PathWays PA website at pathwayspa.org. You can see an example here on this little computer screen of some of the items that we have available there. You can go in and take a look at your own county and your own family type or any family type that you work with in order to see what the self-sufficiency standard is for that family. You can also take a broader look at families and households living below the self-sufficiency standard. And you can go in deeper for those of you who are data nerds like myself, and really do comparisons between different aspects of the self-sufficiency standard and try to tease out information that might help you in your work. Next slide, please. Okay, so thank you very much for having us. Michelle, I'm going to turn it back to you. Erin and I are happy to take any questions.
Great. Thank you so much, both to Erin and Marianne. We now have a few minutes to take questions, whether that you might have. So I will encourage you to, again, use the chat to pose any questions for our presenters. Can you show the slide with the 2-year comparison in housing and salary, etc.? Maybe is it possible for you to pull that back up?
Maybe I think it's slide 6 or a couple more up, sorry, maybe 4. There you go.
Do you want to walk through that one maybe again, Marianne or Erin?
Sure. Erin, do you want me to, or would you like to take that?
You can, please.
Sure. So just to do another comparison here, you can see that in most of the categories that we look at for the standard, costs have gone up. And remember, these are monthly costs. So you'll see that in housing, the cost has gone up by around $60, childcare by around $800, healthcare by $200, The cost of food and transportation has gone down. Some of that, honestly, is just kind of a methodology issue rather than part of the real cost that a family might see. And for those who are interested, we can get into that a little bit more, either now or offline. The net result of all of this is that the miscellaneous costs have also gone up because, as Erin mentioned, they are about 10% of all costs. Taxes and tax credits have changed as well. And it adds up to an increase for this family of about $17,000 per year for a family that already would have been struggling to reach $62,000 in many cases. I do want to point out also, for the first time, the Self-Sufficiency Standard is including an emergency savings amount, which is what they recommend families put by in order to save up to have a couple of months of savings in pocket in case there's job loss, and that would just cover the essentials.
And I'll also note that we intend to share the slide deck with you after, as well as the other materials, so you'll have this to reference for the future. Another question that came through in the chat, regarding the racial breakout for self-sufficiency, are the actual numbers for Black, Latinx, and other non-white underreported and not reflected in this chart?
So that is a good question. I imagine there is some underreporting, just as you would see really in many statistics, and especially when it comes to Black and Latinx families, this is something that can happen. I don't know enough specifically here to be able to say what would and would not be in this chart. But if you have more specific questions about it, I'd be happy to talk about it offline and also get in touch with the researchers or get you in touch with them to learn more and see where there might be some variations.
Marianne, I kind of had a thought about that. I don't know if it's correct or not, but if you take a look at the population just of the United States in general, I believe like the white population accounts for about 70% of the United States anyway, so I'm not sure if that might have anything to do with it.
Thanks, Erin. That is good information to have as well, and certainly I think worth looking into for all of us.
There's two more, and this first one I'll share. What strategies might we support to update the criteria for standards?
So if you're talking about the criteria for the self-sufficiency standard and changing some of that, you could certainly reach out and share with the researchers or with us what you think should be included that is not. There have certainly been changes in the standard, not so much in how it's calculated, but in the recognition that the original model didn't include certain things. And so in different versions that you might see across the country, because the self-sufficiency standard is actually done in many states, there are additional lines added. So you saw the one for emergency savings. Certainly, if you think there are other things that are missing from the standard, that would be worth bringing up to them so that there would be the possibility of including other pieces in future versions. If you're talking more about updating the criteria for, say, the federal poverty level, I think it would be great to talk to your federal Congress people especially, and really share what the difference is between the federal poverty level and something like the self-sufficiency standard or the ALICE report, and show how the federal poverty level really does not keep pace with what families need today. There have been some conversations in the past about changing it. There is a supplemental security measure that went into place a few years back with some controversy. I don't know how many people really use it now. I've not heard anything about it since it went into place. And, you know, it was meant just as a research tool, not as a qualification tool for different programs. So I think there's a lot of conversation to be had about trying to find something that is a better measure of poverty than what we have today.
A few more have popped up, so I'm just going to see if we can get through these. What are the top 3 areas or systemic changes you believe a collaborative could be advocating for to support families based on this information?
So I think probably everyone on this call will have a different answer to that. Erin, I'd love to hear what you would have to say for that.
I honestly would have to look into it more and do some more research. But for my families, a big support that I give to them is maintaining and working towards education. Most of my clients are either moms that did not graduate high school because they got pregnant, or are in high school and have graduated and then had a baby. So they did get their diploma, but the rock and the hard place with that is you need a job to support your family. So one particular client had loads of problems getting a job, and then once she got a job, she kind of put her studies for her GED to the side because it was like, well, I need to pay my bills. But then again, if she doesn't complete her GED, how is she going to be able to make more money? So it's kind of, that's where I don't know, I've come into that problem for the most part with most of my clients.
Thank you. Yeah, I would add to that that one of the things that I have always loved about the standard since I began working with it 20 years ago was that it is really kind of a basic methodology that you can then use to figure out for yourself where you think changes need to be made. There are some people, myself included, who look at this and say, well, wages clearly are not high enough, because we look at this total number and think it's ridiculous, but we look at everything that adds up to it. And a lot of the time people will say, actually, I pay more than that in housing or healthcare or whatever else. So, you know, trying to make sure that people are being paid adequate wages for their work would make a huge difference in access to the standard. For other people, you're able to look at the real cost of something like transportation or food and say, well, what can we do to make that cost more affordable? So it is really just a set of facts that can start the conversation for you. And I think everyone in this room is going to have a different idea of where to start, just based on their own background and their own experience with these numbers.
Great. Thank you, Marianne. The chat is really now popping with a lot of questions, and I'm glad that you guys are able to answer each other's questions and interact. So I'd ask Marianne and Erin if you would go back and take a look at some of the questions and maybe provide answers to the ones that we haven't gotten a chance to go over. And we did hope to have some additional time at the end after breakout sessions to revisit. But one question that came up that I thought would be a great transition to our next speakers was this question about, where did it go? Since families are not earning $80,000 per year in Chester County, how are they getting by? Which is an excellent question, and which is why we had asked representatives from our grantees to also be part of this program to really add depth and dimension to the numbers that we just explored through the Self-Sufficiency Standard report. So we really look to our grantees as our partners on the ground, and so we're really grateful to have their voices today. So I will turn it first to Jen Lopez, the Executive Director of the Friends Association. The Friends Association is an organization that serves and empowers families experiencing homelessness or housing instability. She has over 30 years of experience in creating, implementing, and improving programs for marginalized individuals in our communities. And she has really been bringing that creativity to her programs, even recently in response to COVID-19. Prior to joining Friends, she served as a Deputy Chief of Probation, Parole, and Pretrial Services in Chester County. So thank you, Jen, for joining us, and the floor is yours.
Thank you, Michelle. Thank you so much for having us and, allowing me to amplify and elevate the families that are actually experiencing this, this crisis. It's really interesting to me in looking at this report and hearing the statistics. You look at it at a micro level of how it impacts families day to day, but then there's this macro level of the system change and the focus that we need to have on why this is happening. And ways as leaders that we can push the change in our systems. We deal with family homelessness every day. And really it is a symptom of a much larger systemic problem across the country. Incomes have not kept pace with housing costs. And there's a study out there that's saying since 1960, rents nationwide have risen 61%, while average incomes only increased by 5%. So that's really led to the current situation. There's something like 2.5 million children who will experience homelessness and housing instability in any given year. And we see it all the time. Families are living paycheck to paycheck with little or no savings. They're at the mercy of one accident, one illness, a slowdown at work, a car repair leading to eviction, or credit crushing debt, really. We see federal statistics that say that, close to half of families would have to sell something or borrow money to cover a $400 unexpected cost. And again, we see that every day. And while we see housing as the immediate crisis, we know that's not the magical solution. If we don't address the many, many contributing causes to families losing their homes or becoming unstable, we're just going to convert families from being homeless with few options to housed with few options. So we really do have to create a community of equity and fairness and opportunity for all. This is chronic stress, right? Like families living paycheck to paycheck, having to make decisions between what they pay for. Do they pay for childcare or do they pay for nutrition? Do they pay for a car repair or do they pay for health insurance? Those are decisions families are tasked with making every single day. So at Friends, we really take this holistic approach, and I think this data is so important. Behind the numbers are actual families. So as service providers, we have to understand the data, and then we have to understand how it impacts people and how it affects them on a deeper level. I've been looking at it for years, even in probation and parole. I worked doing the women's reentry program, and we saw so many women coming into the criminal justice system committing what we called property crimes, which were crimes of survival. I had one woman that was in jail at one point because she shoplifted birthday supplies for her child's birthday because she couldn't afford to pay for them. So those are decisions people are making, and we don't condone those behaviors, but we really have to understand the root cause and the trauma that people experience as a result of this chronic stress, and then looking into their personal situations, but also the systemic issues that have contributed to where they are. So, we really at Friends are not only doing the work at looking at the situation now and what's impacting families day to day, but the bigger solutions and how we can bridge the wage gap so that everyone has a fair chance. We like to say that we are not well as a community, as a society, as a neighborhood until everyone is well in our community. And we may sometimes feel like, okay, we have it together financially, we're secure, in our own personal finances, but to truly be a society in harmony, everyone has to have that chance. Everyone has to have access to equal resources and equal opportunities. It's really the foundation of a healthy community. So we run an emergency family shelter, and we also run homelessness prevention programs. So in our shelter, we see a lot of families that are dealing with crushing poverty, and we're connecting them to resources. They're meeting that poverty level guideline. But in our homelessness prevention program, which is our biggest program, we served 81 families through homelessness prevention last year. They're this population. They're the families not meeting the federal poverty guideline, but not self-sufficient by any stretch of the imagination. They're working, and what we might consider as a minor crisis, that we could solve, you know, a medical crisis, a car repair. These are the families that reach out to us when that happens, because they have no savings and they a lot of times don't have the social capital to solve the problem. One family comes to mind, and we of course changed names to protect privacy, but I started at Friends in January of 2019. And, you know, a few months in, I ran into a woman in the office who I knew from my role in probation and parole. Well, I'll call her Rebecca. She came into the criminal justice system because she had a traumatic event. She had 3 boys and she had a baby girl that passed away from SIDS and turned to alcohol to cope with that loss. And she spent some time in jail. She got out. She's working. Now she has a criminal background, right? So that's a barrier to higher wages and to access to a lot of services. But she was working, paying for her rent. Her adult son moved back in with her to be able to afford the rent. She has 2 minor kids, preteens that are school age. So she didn't really have the childcare issue, which we see with a lot of families, like how do you pay for childcare? And I used to see it in the WRAP program a lot. So many families, and I think I saw a question in the chat, how do you afford childcare? Well, you're putting your kids in unsafe situations. Like we have families that do that all the time. They're with neighbors, they're with people within the community that they, you know, they're not getting a high quality early learning. Because they can't afford it, they don't have access to it. But with Rebecca, she was kind of, you know, making things work for a while, and then her son got into a car accident. And he was part of who was contributing to meeting the needs, the basic needs of her family. And without his income, she reached out to friends for assistance. So we were able to subsidize her rent just for a few months. Her income level is too high for SNAP and for many of the other benefits that we talked about earlier in the program. You know, and we see so many of our families are paying 50 to 70% of their income toward their rent. And this was Rebecca's situation as well. You know, most of her money was going into rent. We assist with gift cards for giant grocery cards to pay for food sometimes. So it's really being creative and nimble on our feet to meet the, you know, the needs of families. And I think it's really, you know, beyond looking at these numbers, part of what we do and part of what we've been trying to elevate over, you know, the past year is that this isn't anyone's fault. So we need to make sure as service providers that we're not shaming families, blaming them, that we're seeing this as systemic. You know, this is years and years of systems that have put people in these situations. You know, it's no coincidence that some people have grown their wealth during COVID-19, right? We have people out there whose wealth has increased while millions are not able to pay their rent, millions lost their health care because they're out of work. So the pandemic has really amplified these issues. It's showing all the faults and cracks in the way things have been working or really not working. When we look at, you know, the changes systemically that need to be made, we need to look at minimum wage. We need to look at pay equity for women, right? Women of color, universal basic incomes, you know, the $600 per week extra unemployment for those that got it. You know, you could see the chronic stress lift from families. They could breathe. They finally had enough to pay their rent and meet all their basic needs and do a little bit extra. I had one single dad say to me, I was able to donate to a cause. I've never been able to do that, but I had a little bit of extra. And even though it was only $25, you know, the freedom in that. You know, we need to look at things like rent control and rent caps. We need to look at healthcare for everywhere. And then single parent protections and childcare, because really childcare is unaffordable. You know, it's really taking away the stigma of poverty and the bootstrap mentality that so many have, and looking at the deeper system issues, making sure that our staff, our boards, our donors, and the public in general understand that we can't blame. This is generations of, you know, deep, and especially for people of color, that has impacted it, and impacts housing, it impacts workforce, and it impacts our medical system. So really, this is about finding solutions as a community. So we're not just mitigating the problems, right? We're not just at the top of the plant. We're getting to the root of what's happening. And as the wealthiest county in Pennsylvania, we have an opportunity to make these changes and really be an example and a model for other communities. In the housing world, we say that we want to make homelessness rare, brief, and non-reoccurring. And I would challenge us to make this the same. This should be rare that a family cannot meet their basic needs. It should be brief, and it should never, ever happen again. So thank you so much for having me.
Thank you, Jennifer. That was excellent. Wholeheartedly agree. I'd now like to introduce Joyce Chester. Joyce is the president and CEO of Chester County OIC, the Opportunities Industrialization Center. The Fund for Women and Girls has been a partner in OIC's work. Most recently, we supported OIC's efforts to take a deep look at their Certified Nursing Assistant program, where they were seeing high program graduation rates, yet saw that their graduates still encountered many challenges to getting ahead. So Joyce will be touching on that a bit. In addition to her work at OIC, she has extensive experience working with this overlooked and undercounted population as a member of the Chester County Workforce Development Board, the Chester County Community Services Planning Committee, a member of Black Women in Chester County in Action, and the Westchester Area School District Board. So with no further ado, I give you Joyce.
Thank you so much, Michelle. And Jen, thank you so much for that wonderful lead-in, because everything that you said, I say. I totally agree. I've had the good pleasure and good fortune of working with Jen on some of these systematic issues, including drug court in the past, and just taking a look at how we can divert the punishment of poverty and justice involvement and turn it into something that's productive. So here at OIC, our legacy is based on education being the great equalizer. And we work with adults, and knowing the value of getting an adult educated so they can create options for themselves, create options for their family. We know the very importance of that. And we strive to provide the ability for people to access opportunity that can help their lives change. Michelle talked about our Certified Nurse Aid program, which we developed it was about 18 years ago, I'm sorry. And the reason we developed that program is because I was at a Health Alliance meeting one day, and I sat there and people were talking about entering the healthcare field, that being a wonderful career ladder. And I thought, if we could bring someone who is totally unskilled and give them information that helps them create a skill and be certified in that skill in a relatively short time frame, get them on a career ladder where they can move up to create economic self-sufficiency for themselves and their family, that would truly be a gift, not only to them, but to the community, and create a legacy for their families, and particularly their children. So that was the birth of the Certified Nurse Aid program. And we have seen incredible outcomes through that program and changing the lives of the people that are served through that program. But I want to share something with you. We know that education is the great equalizer. Jen made a comment about the bootstrap or whatever. You can only pull that works. Bootstraps work if we were on a level playing field. And we know that we're not on a level playing field. So we have to take our constituents in from where they are when they walk through the door. And it's usually not in the place of, I'm ready to get an education and move up. Usually they're coming in at a deficit because of poverty, because of being underskilled, being undereducated, and not only for themselves, but having a legacy of being underskilled. People in the families underskilled and undereducated. And now the folks coming through our door are having families, having children now that they must support when they are barely able to take care of themselves. And oftentimes coming in the door with legal issues that they have to regard, as part of this, this is as part of who they are when they come to us to start their educational path. So I'm going to share with you two stories. One of the stories, the first story that I'm going to share, I'm just going to call her Student A. She came to us to become a CNA some years ago. She finished the program. She became a CNA. She was married. She had one child. She went on to become an LPN. She currently works at Chester County Hospital. She recently purchased a house, and she will continue on to school to become an RN. This is the reason, this is the model we created. This is the model we had in mind with the CNA program. She came to us unskilled. She became skilled. She was able to take that skill. Her family has benefited from her skill, and she has moved on to become a tax-paying member of our community. That was Student A. It doesn't always turn out that way. Student B, I'm going to share this story. We had a student come in the door. She came to us with 3 DUIs. So there was a legal background already as she walked through the door. She finished the program successfully, very bright young lady, but her support system included a boyfriend who, once she graduated, once she got a good paying job that was enough to take care of her and her son, her boyfriend came by her apartment, shot up the apartment, beat up her brother, who was part of her support system, and she still had to continue to work. She still had to get to work, provide childcare, do all of those things, get booted out of her house now because her landlord obviously doesn't want the house shut up. And so she became housing destabilized. Oftentimes, this is the story we face. So it's not just about, it's really important that we understand it's not just about placing somebody in a job. It's all of the things that come around that. It's all of the things that they bring with them to the table that we have to say, okay, let's lay all this out and let's see how we can figure this out step by step to get you to a place where you can enjoy self-sufficiency. You know, if you're driving to work and your license was suspended because you had 3 DUIs, but you have to drive to get to work, the only way you can get there, there's that stress that you bring with you to the job every day, every single day. So how do we help them relieve that and get their life in order? That's what we work so diligently at OIC with comprehensive case management, to help people kind of organize their lives so that they can enjoy the benefit of, once they get to a point of being able to make a self-sustaining wage, that they can actually enjoy that wage. When we took a look at that table with we had housing, we had childcare, we had transportation. One of the line items that we add to that budget is the cost of legal expense, because undoubtedly there's some judge, there's some court that has to be paid off with many of our constituents, that if that's not paid, then that's going to set them back. Either they're going to go back to jail, they're going to get another fine, and so on. So we have to add that and make that part of their operating budget to keep them going. Now, common themes that we see with not only those that are in our CNA program, but others that come through our work programs: economically disadvantaged, socially disadvantaged, oftentimes coming with children, most times having a lack of familial or friend support. So there's no network in case, what if I have a misstep, or what if I need somebody to help me through something? Very little support. And then limited access to resources, either perceived by them or actually limited access to resources. If they perceive that they don't have the resource, if they don't understand that a resource is available, then it's not available. So we have to, that's one of the issues that we take a look at for what they can do now to relieve them of some of the anxiety of the issues that they deal with, what we can do midterm to help relieve them tomorrow, and then take a look at the future. But we have to deal with the now first. Oftentimes our constituents come to us and they're hungry. They're just hungry. They haven't had food. They haven't been, it's getting the kids, making sure the kids have something to when they're dropped off at daycare, they're not just dropped off. So when they come to us, I mean, physically, we had a funder that walked in the door one day. I was explaining this to them. I said, sometimes when our folks come in the door, we have to just make sure they can have food so that they can be able to receive what we are trying to share with them. So we work with, I get very passionate about this because what I understand is this: most of us have had the benefit and the luxury of having somebody support us to get us to where we are today. Our parents have been iterative in the message they have shared with us each and every day. Our friends, our associates, the people that we have chosen to have around us, they have been the people that have gotten us where we are today. Our clients, our constituents have not had the benefit of that. And honestly, I always say this: if you don't know what a chair is, if you have never seen a chair, you would not know what to do with it when you saw it for the first time. Many of our students are seeing success education for the very first time and trying to understand the value of employment and the value that it brings to their life. And not just to, what someone mentioned, the student who got the GED. She was working on her GED, but she needed to get a job. And so the job then tipped the scales on what I have to do for myself now. But getting that message to that person of, this is why this is, that might be important. That extra 5 cents on the dollar that you're getting today might look shiny today, but what are you going to do next week? How are you going to make it through the next week? And then the next, and then next year. And sometimes it's hard to see for our constituents now because they're dealing with things like food insecurity and housing insecurity, transportation insecurity, childcare insecurity. So we have to help create that balance, help them. And it's the iterative message of, why don't we try this? Let's give you this option. What about this option? So I want to go back to my story in the beginning. I shared with you one of our success stories where the young lady went through the CNA program, became an LP, and brought a house. Well, she's working at Chester County Hospital, and in the beginning days, before they got PPE, she had no mask. The hospital did not have masks to dispense. And I just happened to buy 2 masks because I was cleaning out mold in my house. And I said, you know what? Stop by my house. I'm going to give you the mask that I purchased. I had purchased them some time ago. She came by to my house and she said to me, how could a job that I love so much kill me? She said, I love this job, but I know it could kill me. And I thought about, the journey that she went through to create this model of self-sufficiency for herself, which could almost be overturned by the pandemic. So while she kind of got on an equal playing field, she is doing her best now to navigate that. So all of these, the pandemic, before the pandemic, we had so much our students and our constituents had so much to deal with. The pandemic, just serves as a derailer, but it opened up windows where we could see the inconsistencies in service and capability and access points for our students and our constituents to be able to take care of their health, childcare, transportation, and all those things. So as a community, it's up to us to work on these systems to make them better. I hope I didn't go over my time. I just get really caught up and passionate. And
your passion comes through. That's great. No, thank you so much. You're right. I mean, that's part of the reason why we had this event, is really to expose those barriers that are systemic, that go beyond the control of our clients and the people in this community. So we appreciate both Erin and Marianne who've brought the data to kind of bear that out, but also to you, Joyce and Jen, who have really added story to these numbers and made this data real to our audience. So thank you so much to all of our presenters. We're going to be moving into the breakout rooms, and don't worry, we added a buffer here, so I do believe we will still be able to end right on time at 10:30, but we will be breaking out into the breakout rooms for the next 15 minutes or so.
Welcome back. Going to give you all a couple more seconds just to see if we get another bunch of participants in before we do our wrap up. While people are coming in, if you want to start putting into the chat any feelings or anything that came out of the breakout groups that you want to share, that would be great. I see one saying we needed more time, which is always the way in a good breakout group. So while I'm sorry you didn't have more time, I am glad that there was a lot of conversation. So I want, before we turn it over to Michelle, you know, again, if you have any questions or thoughts that came up in your breakout group or just things you've been thinking about the standard, we would love to see that in the chat. Also, I'm curious, just from my own perspective, those of you who have been thinking about this from kind of a public policy standpoint, if you have any thoughts on any policies that you think could be shifted or made better that would help households living below the standard. And then finally, you know, this might not be something you want to share with everyone, but I would encourage you all to think about your own experiences with not feeling self-sufficient, whether it's you or a family member or a client, and how you feel like that could really be brought more to the forefront, and how more people can share those experiences, especially with our legislators. So again, that might be a little more complicated than what we can do in the chat, but I think it's a really important thing to think through as we wrap up this conversation. And Michelle, I'll keep an eye on the chat and respond to anything in there, but I'll turn it over to you for any final remarks.
Great. Thank you so much, Marianne. So as we wrap up today, I just want to thank again our speakers and thank you all for your time and participation. There will be an email that will go out later today with information from today. It will include the handouts, the slide deck, and a post-event survey. So we ask that you take 2 minutes to complete the survey, as it really offers opportunities to take this dialogue further. As many of you had noted that you wish there was more time. So, you know, we do hope to continue to foster this conversation. And also just give you the ability to connect with fellow attendees. So please fill out that survey. Maeve's also going to put the direct link in the chat now. So in closing, I wanted to share an excerpt from an email we received from a community member. They signed the email SK, so I'll refer to them as SK. They had sent this in response to, or upon hearing of our event. And so I just wanted to share a little bit from their email. I randomly heard about your event. It is about people like me. Thank you for shedding a light on how hard it is to make it all work when you live near the poverty line. While the attendees are zooming into your meeting from their comfortable homes, I am working from home full-time while monitoring homeschool during the school year to my child, not collecting disability welfare, but having a disability. Working at a job I am suited for with mice in the corner and possibly running across my feet. Where there's no AC all summer when I work because the window AC is too noisy, so I must turn it off to do my job. Where there's toxic mold that resulted in a prescription of asthma meds with a $600 monthly copay after corporate insurance program applied. Where there's no light available on my desk where I work because the electricity is really old and it can't handle more than the computer, so I use an extension cord from an adjacent room. Where it is so cold in the winter from the inefficient 1980s heating thermostat that I wear 2 sweaters and a coat indoors. Where I cook lunch on a stove that has no numbers on the dials because it is from the 80s. In a kitchen where ants come in, so I pay for the ant control myself, and store all food in plastic Sterilite bins and Ziplocs all year round. My daily discomforts are small, but they are big when you add them all together. I am certainly not lazy, and I'm certainly not dirty in my housekeeping. Why not get a second job, you ask? I do work some overtime with my current job, and I'm on the roster for a second job. Plus, with me having a disability, this is really already pushing my limits that I work 40 hours as a single parent. pushing my limits. Now more than ever, individuals in Chester County are really pushing their limits just to make it. And we really hope that today's program is a step towards collective action to redefine limits and the structures that push people to them. So I thank you for your time and your work towards that, and I hope you stay engaged with us as we continue this conversation. Have a great day, and we'll see you soon.